Is this a heart attack? Warning signs and 5 life-saving tips. A heart attack is a blockage of blood flow to the heart. When the heart doesn't get enough oxygen, it can become life-threatening. Heart attacks are medical emergencies that shouldn't be ignored and should be addressed as soon as possible. The chances of surviving a heart attack or saving a life depend on several factors, but what matters most is being able to identify when one is taking place and remembering 5 steps. As the weather gets warmer, health issues that you may not be aware of may flare up. To be prepared, read on for life-saving tips for heart attacks. Learn more about heart health tips by reading How to Check Your Heart Metrics at Home, 6 important blood tests to take, and understanding the importance of your blood type. Common symptoms of a heart attack. When you think heart attack, classic symptoms such as chest discomfort might first come to mind. Heart attacks can present differently in men and women and in people with certain diseases, like diabetes. Heart attack symptoms could include chest discomfort, pain or pressure that radiates up to your jaw, your back, or your left shoulder, bad indigestion, or nausea, extreme fatigue, shortness of breath, feeling generally unwell, essentially anything from the belly button up. Constant pressure should raise concern that you should see your doctor, and it's okay if it's something else. We'd rather have an individual come see a healthcare professional and get evaluated rather than toughing it out at home, because that is what contributes to the escalating risk of death. 1. Call 911. No matter what, if you feel any of the above symptoms, even if you aren't sure it's a heart attack, you should call 911 immediately, doctors recommend. If you feel unwell or you're starting to have chest discomfort, seek medical attention quickly, because the sooner you get treated, the better. A lot of patients ignore their symptoms, and by the time they come in, their heart muscle has already died. The number one indicator of how well you are going to do after a heart attack is how fast you recognize your symptoms. Read ads. There is a strong relationship between when you start to have your heart attack, which is generally when symptoms start, and how fast doctors can open up the blocked coronary artery that is causing it. The shorter the time, the better the outcomes, not just regarding survival, but also the likelihood of heart failure or needing to be readmitted to the hospital. When you get to the hospital, medical professionals will likely perform an electrocardiogram, which will determine the diagnosis of a heart attack. If it is a heart attack, you'll be taken to the cardiac catheterization laboratory, where a coronary angiography will be performed. If you have a blockage in your coronary artery, the doctors will offer treatment with a balloon and a stent to keep the artery open. Many people are hesitant to seek emergency medical care due to a lack of insurance or immigration status. In the U.S., hospitals are required to treat all people who come in with life-threatening emergencies. It is a lot better to be treated and deal with the financial ramifications after the fact. In most cases, costs can be sorted out with the hospital. 2. Have an ambulance take you to the hospital if you suspect you're having a heart attack. Don't drive yourself to the hospital. Call an ambulance. You could lose consciousness and hurt yourself or others on the road. The same goes for having a loved one drive you if your symptoms worsen. They won't be able to help you while they're driving and may be distracted. Paramedics can provide the best and fastest care while you're on the way to the hospital, including giving you an assessment and providing some treatment. If you're with someone who is having heart attack symptoms and becomes unconscious, you should first call 911 and then engage in CPR. You can find free CPR training at your local American Heart Association branch and many other places. 3. Take aspirin. If you have it, if you're having heart attack symptoms and have access to aspirin, take a full dose of 325 milligrams after calling the ambulance, Beachy says. If you have baby aspirin, which comes in an 81 milligrams dose, take 4 of those. He recommends chewing it instead of swallowing, so it gets into your system faster. The reason? When you're having a heart attack, a plaque inside your arteries becomes unstable and ruptures, which forms a blood clot that can close off supply to that artery. Taking aspirin can help break down some of that blood clot. 4. Advocate for yourself. In an ideal world, healthcare providers would take all patient concerns seriously when it comes to heart attack symptoms. But studies show women and people of color are less likely to receive adequate treatment for heart attacks and heart disease. For example, older Black women were 50% less likely to be treated when they arrived at a hospital with a heart attack or coronary artery disease symptoms than white women, including after accounting for education, income, insurance status, and other heart health complications like diabetes and high blood pressure. A 2019 study found. It has been very clear over most of our history in the U.S. that women and people of color are not heard. Their symptoms get dismissed, and they have worse outcomes. As a health care system, we have a lot more work to do to change that system so that each person can get equitable care irrespective of their demographic. Until that time comes, patients need to be their own advocates and speak up for themselves, she adds. If they aren't being heard, they have the right to seek care elsewhere. One tip recommended: if you feel a provider isn't taking your symptoms seriously, for heart health or otherwise, you can ask the provider, "What is your differential diagnosis?" A differential diagnosis is a term to describe what the different diseases are that could be contributing to your symptoms, basically asking the provider to explain why they've ruled out a heart attack and what else it could be. That might help a person realize, oh, I haven't effectively tested to make sure this is not cardiac disease. You can also bring a family member or friend to help ask questions on your behalf. Write down questions in advance if you can, so you can have them addressed during your short visit. And call back with any questions that weren't answered. If you're not satisfied or feel that you're not being heard, seek out another care team. 5. Work on prevention. You've heard it a million times, but that is because it is true. The best way to prevent a heart attack is by maintaining a healthy diet, doing moderate exercise for 120 to 150 minutes per week, keeping your cholesterol and blood pressure under control, and not smoking. Heart attacks can happen to people of any age, race, or gender. You should get regular physical exams with your primary care provider to assess your risk and make lifestyle changes that can help with prevention. Some people might also benefit from taking a baby aspirin every day as a preventative measure, but you'll need to talk to your care provider about that. Exercise is important even if you have a history of heart trouble. Knowing what to do to prevent and respond to a heart attack is just one of the many important elements of your health you should know about. Read on to discover the best workouts to strengthen your heart, the difference between the types of cholesterol, and how your diet affects your health. The information contained in this article is for educational and informational purposes only and is not intended as health or medical advice. Always consult a physician or other qualified health provider regarding any questions you may have about a medical condition or health objectives.